I'd like to talk to you a little bit about scoliosis. Scoliosis has some special problems. As you can see, usually there's more of a convexity to the rib cage, rib hump on one side or the other, and the back usually compensates down here a little bit lower by going anterior, depending on how the curve is in the spine. But if you catch it early, you can really help scoliosis and you can really straighten up their back. And with Stephanie here, she's 17. We started about 4 years ago really seriously working on her back, and she's seen a great improvement in her posture. And you will see after we adjust her just how different she looks from what she's doing even when she comes in, when she gets her adjustment. Although overall she's improved quite a bit. She used to have way more curvature in her spine. She's still, after a few weeks without getting an adjustment, she still needs regular treatment because it kind of sort of drifts out after a little bit of time. As you can see right here, we're going to work a lot on her rib cage, and we're going to work on her, she has her head goes a little forward, so we're going to work on the upper cervical area here, restoring some more curve. So as with all my patients, I like to start by bringing them up on the table and letting them down. As you see, I feel like I get a more clear reading of what's going on with their back and their spine when they start from standing and they're just laid straight down on the table. So I always use the high-low part of the table because it actually puts people all in a kind of a neutral position for me to start with. With Stephanie, she's improved a lot over the years with the amount of scoliosis and curvature she has, but she still tends to have a problem on the right side here where the worst part of the convexity is of the scoliosis. So I'm going to focus on the thoracic and the rib cage and the ribs right now, and what I'm going to do is I'm going to start putting this scoliosis into place. So what I do with this is, I told you how the ribs flip up. Well, they're flipping up in here, and I'm going to turn around and adjust them, flipping down like this. We're going to do a little adjustment on them, flipping them down. You want to keep your hands flat, as I told you. You don't want them to be too solidly on any one rib. And usually wherever it's twisting the most, you're going to find one of those rib vertebrae. So I'm going to flip that down in like that as I go right here. And with her, I can actually do a little bit of a posterior. So we're going to contact on the posterior, take a little breath, and then let all your air out. And I'm going to push them down into place. So you felt that one set when I did it. And we're going to do a little bit more on this rib part, on this rib hump. We're going to push it down as I go. I'm going to work on the upper ribs here, the first rib. We're going to go all the way down, all the length of her back on this side. Flip that down. And the same thing on the other side, although it's not needing as much adjustment. You can see I don't use hard pressure. I have the drop set really light, and I actually just use my body weight to drop it. So then I will turn her on her side facing the door over there. I like to use facing the door or the window because people get confused on the table and they get right and left backwards. So now I'm going to do the tucking part of the adjustment on the ribs, and remember how I contact on the side of the rib and help the rib helps me to drive the vertebrae into place. We're going to do the same thing, kind of tuck it down. Come back a little bit more straight. That perfect. And I concentrate on that area where it's really pushing out right here. Oh, there it goes. So we're going to go all the way up and down here and try to tuck those back down in a little bit. Sometimes I go inferior when I drop it, so it helps to set them in a little better right in here. Okay. That looks better. Okay, one more here. Okay, now I'm going to have her turn over on her back. And I'm going to test her here for anterior in her in her lower rib cage. Push up for me. And you can see that makes her weak. And you can kind of see when you look at the patient that their lower rib cage is flipping up, and it's almost like they're going like this. So when I see that, I actually kind of tuck those ribs down. I try to tuck them down like this, flatten them out, and I'm actually adjusting the anteriority out of the lower part of a rib cage. And you can kind of contact on the side and tuck them this way as you go. like that. And you can see it's already starting to reduce there. And I'm again using the flat of my hand as I adjust, like that. And so you can kind of see how it's starting to tuck down, and she's starting to get a little bit more straight in here. She has a tiny little bit of curvature down in the lower back. So we're going to flip that lower back down just a little bit. Like that. Just a little bit more of that. I'm using LD for the thoracics, and when I go down to the lumbars, I'm using the PL setting, so I'm getting the pelvic and the lumbar together, and the lumbar and the dorsal together. So that straightened her out quite a bit. Okay, now I'll just work on her neck a little bit, just relaxing it. Just we're going to go across. Okay, and a little bit this way. Okay, neck's pretty good. Okay, turn on your side. I'm going to show a side posture move. For side posture, I lift the head up so that the shoulders, so it keeps it more of a comfortable, gives the patient a little bit more comfort. And I have the bottom leg straightened. We have them hook their toe around the back of their knee there, so kind of keep that hooked. And I have them cross their arms like this. And I contact on the area that I'm trying to adjust. Like say, if I'm working on a lumbar, I'm going to contact on the lumbar. If I'm working on the pelvis, I'm going to contact right back here. And I do a little motorcycle kick. I put my knee up right on the crook of their leg here. That's where my knee goes. So that's one of my contact points. And then I just sort of pull them, stretch them around like that. And it's a real easy adjustment. So turn on the other side. Same thing here. We're going to have her hook her toe, and then we just do a kind of a little stretch this way and pull her over like that. It's really easy. Okay, turn on your back. So I have another little move that I use when people have sort of a rounded shoulder. They have a lot of problems in the upper thoracics, you know, hunching and that type of thing. And it's a stretch move that helps to open up the whole shoulder girdle. So what I do is I take their arm and I place it down along the side of their torso here. And actually, I use my hand as I use my hand. I go underneath the axilla. I hook my finger in the axilla area, this finger. So what I'm going to do is, as you notice, I'm going to go straight down this way and hook my finger under the axilla like that. So that's where I'm going to get some of my oomph to actually put this adjustment in. So actually, I'm going to contact with my hand. My contact point is right along the inside of the ribs between the spine and the scapula here, and I get right on the edge of it so that my hand is right along the side of the spinuses. And as I push down here, I pull the shoulder around like that and stretch it. It's a good, there it goes, see? Actually puts those ribs in really well, and it actually stretches the shoulder. Sometimes you'll even feel the clavicles adjust into place. And same thing on this side. I'm going to do the same on both sides. So I'm going to bring my hand straight down and hook my finger under the axilla area. Put my hand right here on the inner side of the scapula. And I put that in, and it actually sets all the ribs and the shoulder at the same time. That one went better. Let's try this side again. Okay. Okay, one more. A way to get them to relax is to kind of roll the shoulder first. So this is what I usually do first, to start rolling the shoulder before I do that one. And then I go under here and kind of roll this down. Relax for me a little. Good. Okay. Notice I'm not bending my elbows as I drop. So this is another thing I do. I kind of keep my body weight makes it drop. So I'm not doing a lot of pushy on the person. I'm actually keeping my elbows straight as I drop. Okay. Okay, now we're going to bring her up. Okay, as you can see, quite an improvement in our model's posture after we adjusted her ribs. See, I worked on this upper rib area, and we brought the lower rib that was going forward, so now she's standing up really straight. And you can see as she turns that she actually even looks taller.